This video will explain what an ostomy is and how to care for your child's ostomy at home. After surgery, a nurse with specialized knowledge about ostomies, called an ostomy nurse, will help you care for your child. Your ostomy nurse will answer your questions and teach you what you need to do to care for your child. You will also receive an ostomy booklet that will be a reference for you when you go home. Normally when we eat, food goes from the mouth, down the esophagus and into the stomach, where it is broken down and mixed with digestive juices. From the stomach, the food mixture enters into the small intestine or bowel. More digestive juices are added in the small bowel to help break down food into particles that are absorbed into the body. The small bowel is responsible for most of the digestion and absorption of nutrients. Leftover food products and water go into the large intestine or bowel where water is absorbed. The remaining waste passes into the rectum and leaves the digestive system through the anus. If parts of the bowel no longer work correctly or become diseased, they may need to be removed. In these cases, a stoma may be needed. A stoma, or ostomy, is a surgical opening in which part of the large or small bowel is brought to the outside of your child's tummy and is turned back on itself like a cuff. This opening allows waste to leave the body without going through the damaged parts of the bowel, or to bypass an area where part of the bowel has been surgically removed. The ostomy may be temporary, while the damaged part of the bowel heals, or it may be permanent if the bowel is removed. Most children have a temporary ostomy and will have another surgery to reconnect the bowel. An ostomy can be anywhere in the bowel. For example, an ileostomy is located in the ileum of the small bowel. Depending on how close the stoma is to the stomach, the stool may be very watery. Ileostomy stool contains digestive juices that are harmful to the skin. Ileostomy stool usually doesn't have a strong smell, and your child may not have much gas. A colostomy is in the large bowel. The closer the stoma is to the rectum, the more solid the stool will be. Gas and odor are present in these ostomies. Everyone's stoma is different. It may be flat, oval, or round. It may be large or small. Also, some stomas will be very large right after surgery, but will slowly become smaller over the first month or two. The stoma should be red and moist, like the inside of your cheek. The opening through which waste drains is usually in the center of the stoma, but it could be somewhere else on the stoma. Stomas don't have nerve endings, so they're not painful. A person with an ostomy has no control over when waste will pass through the stoma, so must wear a pouch over the stoma. The pouch can then be emptied at a convenient time. A pouch is the small bag placed over the stoma to collect the stool. There are many types and styles of pouches. These are sometimes called an appliance. Most ostomy companies make supplies for children with ostomies. The pouch and all the products used with it are called a pouching system. The type of pouch your child will wear will be determined by the size of your child, the size of the stoma, and where it is located. All pouching systems include a pouch and a skin barrier, also called a wafer. A pouching system can be either one piece or two pieces. A one-piece pouching system has a pouch that is connected to the wafer. A two-piece pouching system has a pouch that is separate from the wafer. The wafer sticks to the skin around the stoma and protects the skin from waste. The pouch connects to the wafer and collects stool from the stoma. It also limits odor. The wafer and pouch must connect securely to prevent leaking. The wafer will stay on better if the skin area around the stoma is flat. To further prevent leaking, you can use paste. Paste should be used like caulk to fill in gaps and creases on the skin around the stoma. There are two types of ostomy paste. Tube paste contains alcohol and may sting if placed directly on the skin. To apply tube paste, squeeze it into a syringe and push from the syringe onto a wafer. Keep the paste open to air for 30 to 60 seconds before placing it on the skin. This allows the alcohol to evaporate. Strip and ring paste do not contain alcohol and may be placed directly onto the skin. To apply strip and ring paste, pinch off a small amount and roll it into a thin rope. Then place the paste at the base of the ostomy and shape it like putty to fit next to the stoma. Keep in mind that paste is not glue. It shouldn't be used to stick the wafer to the skin. Using paste as glue can actually prevent the wafer from sticking well and can make it painful to remove. This might require more frequent pouch changes and cause more skin irritation. The skin around your child's stoma should look the same as the rest of the skin on his tummy. It should not be red or sore. Here are some do's and don'ts to help keep the skin around the stoma healthy. Don't use lotions or moisturizers. They keep the wafer from sticking to the skin. Use the right pouching system, the one your child's team suggests. You can avoid many skin problems such as irritation or sores simply by using the right pouching system. Check the wafer every day. Make sure it's secure and not leaking. Leaking under the wafer can irritate your child's skin. Check the skin around the stoma for redness with each pouch change or with increased signs of leaking. In the hospital, your child's nurse will use gloves to empty the pouch. At home, gloves are not necessary. You will need to empty the pouch when it is 1/3 full of stool or air. A pouch can be emptied in a few different ways. Before you begin, get your supplies together. For a baby or a small child, you can empty the pouch using a syringe and drain it into a small basin. You can also drain a baby's pouch into a diaper, which you then throw away. An older child can sit on or stand close to the toilet and empty the pouch directly into the toilet. First, place some toilet paper in the toilet prior to emptying the pouch. This will reduce the amount of splashback. Undo the clamp on the pouch, slowly lower the end of the pouch, and drain the contents into the toilet. If the stool is thick and won't drain, first squirt a small amount of water from a bottle or syringe into the pouch. Agitate it gently. Slide your fingers down the outside of the pouch to push the stool out. Clean the opening of the pouch with tissue or a paper towel. Close the pouch with the clamp. If you do not clean the opening of the pouch, stool will dry and cause the pouch to smell. The length of time between pouch changes is called wear time, and it's different for every child. Premature infants and children who have new ostomies will have limited wear time because of the large amount of liquid stool. Over time, the amount of stool decreases and may become thicker. In general, a pouch should stay on your child for at least 24 hours. Normal wear time for infants with an established stoma is 2 to 3 days. Older children can go 3 to 5 days between pouch changes. Wear time is affected by how active your child is, how watery the stool is, and how often the pouch is emptied. Remember to empty the pouch when it is 1/3 full. Otherwise, the pouch gets heavier as it fills and will pull away from the skin. First, gather all the supplies you will need to change the pouch. This includes the new pouch, a wafer, paste, stoma powder, scissors, measuring guide, gauze or soft cloth, and warm water. You may need to have someone hold your child's hands while you change the pouch. If you don't have someone to help, secure your child's arms by wrapping them in a blanket. Older children can help by holding supplies and handing them to you. First, empty the pouch, and then take it off by lifting the wafer while pushing the skin down and away from the wafer. Next, clean the skin around the stoma with warm water and a soft cloth. After cleaning, dry the skin well. Check the stoma and the skin for any redness or sores. Measure the stoma using the guide that comes with the wafers. Trace the opening of the stoma onto the paper backing of the wafer. Then cut the wafer with scissors. Run your finger around the cut rim of the wafer to smooth any rough edges. Place the wafer over the stoma to test the size, and if needed, trim to fit. The opening in the wafer should be 1/8 inch larger than the stoma. Warm the wafer to help it stick better by placing it between your hands or under the child's body. Remove the paper backing from the wafer. Try not to touch the sticky side of the wafer. If you are using paste, apply it either to the wafer or around the stoma. Fill in skin creases with paste. Place the wafer around the stoma, making sure not to trap the stoma underneath. Press the wafer onto the skin, starting at the stoma and moving outward. Smooth out any wrinkles and make sure the wafer is secure. Use a cotton swab to press the inner edge of the wafer around the stoma. If you are using a 2-piece pouch, attach the pouch to the wafer. Secure the end of the pouch. Warm the wafer again to help it stick. It is okay to cut the whole of the wafer off-center to make it fit your child's stoma. Attach the pouch so the opening points in the direction you want it to empty. For babies, you can position the pouch to the side so it is easy to empty into the diaper. Older children usually like the pouch angled between their legs, making it easier to empty when sitting on the toilet. Children with ostomies do not need a special diet, but may need a few precautions. Because food does not go all the way through the bowel, some of it does not get completely digested. Foods that may cause problems are those with casings, such as hot dogs and sausage, and those that are high in fiber, such as raw fruits and vegetables, dried fruits, nuts, popcorn, and beans. In an ileostomy, these type of foods can cause a blockage if not chewed well. Other foods can change the consistency of the stool. Some medicines are absorbed in the bowel. Depending on where your child's ostomy is, these medicines may not be absorbed and will pass through the stoma into your child's pouch. Make sure your child's doctor orders medicines that can be absorbed in the stomach or above your child's ostomy. Children with ostomies are just like other children and should not be treated differently. You may bathe your child with the pouch on or off. Water will not go into the stoma. One-piece clothing is often best for infants and young children with an ostomy. This type of clothing hides the pouch and prevents them from pulling it off. Clothing with elastic or belts that run across the stoma will irritate the stoma and should not be used. Children with ostomies can participate in most activities. Ask your child's doctor before participating in contact sports. Your child may go swimming, but should always wear a pouch. Special tapes and products help keep the pouch in place while swimming. Some foods, as discussed before, may cause a blockage of the ileostomy if they are not chewed well. A blockage means the stool cannot pass out of the ostomy. This will cause pain in your child's tummy and is an emergency. You should call your child's doctor or the stoma nurse immediately. Bleeding. A stoma may bleed easily. Do not be concerned if this happens. You can hold your finger over the area that is bleeding for a few minutes until the bleeding stops. If there is a large amount of bleeding or you cannot stop the bleeding, call your child's doctor. Retraction. Sometimes the stoma retracts or pulls back into the body so that it is not above the skin surface. A special type of pouch is needed for these types of stomas, and good skin care is especially important. Contact your ostomy nurse or doctor if this happens. Prolapse. Sometimes more of the bowel comes to the outside, making the stoma longer. This is called a prolapsed stoma. It happens more often in children because of their weak abdominal muscles. Call your child's doctor if your child's stoma prolapses. Peristomal hernia. Occasionally, part of the bowel pushes through the muscle and causes a bulging of the skin around the stoma. This is called a peristomal hernia and can be seen around the whole stoma or just part of it. The hernia can come and go depending on the pressure in your child's tummy. A pouching system with a very soft skin wafer is needed around stomas with a peristomal hernia. It may need to be changed more often. Stenosis. Stenosis is a narrowing of the stoma opening. This results in thin or ribbon-shaped stool. If your child goes longer than normal without passing stool, call your ostomy nurse or doctor. Necrosis. Sometimes the blood supply to the stoma can get blocked. If this happens, the stoma will become dark blue in color and then black. This is called necrosis and is a medical emergency. Call the doctor immediately if the stoma becomes very dark in color. Sometimes, the skin around the stoma can become irritated. There are several causes for this, and treatment depends on the cause. Rashes can be caused by moisture in the skin from stool leaking under the wafer, irritants from soaps or dyes, and from the products themselves if your child has an allergy. If your child has a rash or skin irritation around the stoma, clean the skin with warm water and dry well. Apply a small amount of ostomy powder to the rash and brush off the extra powder. Then pouch as usual. It may be necessary to change the pouch more frequently until the rash is gone. Talk with your child's physician if the rash continues. The physician may prescribe an antifungal powder or a change in ostomy supplies. Your ostomy nurse and case manager will help you order ostomy supplies before you leave the hospital. Insurance companies may vary in which products and home health companies they support. Contact your insurance company and follow their guidelines. Always order early so you don't run out of supplies. If you have any questions or concerns, please feel free to contact the ostomy nurse at the hospital or your child's physician. The more you help with your child's ostomy in the hospital, the easier it will be when you go home. Take every opportunity to care for the ostomy while your child is in the hospital. Do not hesitate to ask questions and get the information needed for you to comfortably care of your child's ostomy at home.